Good morning, everyone. Welcome back to our ESP session. Today, we're moving from lecture mode into a discussion. We've covered the distinct roles of the radiologist and the radiographer. Now, I want to hear your questions. This is your chance to clarify how this works in real clinical English. Who wants to start?
Good morning, sir. I understand that radiographers don't diagnose, but in the clinic, if I see something obvious on the image, like a big fracture, can I point it out to the patient or the radiologist? What is the safe way to say it in English?
That is an excellent question, Rena, and it gets to the heart of professional scope. You are right. You cannot provide a formal diagnosis. That is the radiologist's role. However, you are not expected to be blind. You are the first person to see the image. In English, we use what's called flagging, or descriptive language. You don't say, "There is a fracture." Instead, you say, "Dr. Anwar, I notice an irregularity in the cortex of the femur." Or, to the patient, you never say, "It looks broken." You say, "The doctor will need to review the images carefully." This protects your professional boundary while still contributing to the team. The key is using descriptive, non-diagnostic English.
Sir, in the script, it says patient preparation is a shared responsibility. In the ward, if the nurse hasn't prepped the patient correctly, like they forgot to remove metal, and the radiologist is waiting, how do I communicate that problem without blaming the nurse?
Stephen, that's a very practical and common challenge. This is where professional, diplomatic English is crucial. You are the final checkpoint for safety. Never use accusatory language like, "The nurse forgot." Instead, you use problem-focused, solution-oriented language. When you talk to the radiologist, you say, "Doctor, we have a slight delay. The patient still has some jewelry on. We are removing it now and will be ready in 2 minutes. If you need to follow up with the nurse later, you say, "For the next scan, it would help us if we could double-check for metal beforehand to save time." This keeps the focus on patient safety and teamwork, not blame. It's professional English that maintains relationships.
Mr. Boody, I'm still confused about the difference between just talking to the radiologist and interprofessional communication. In the ICU, if I have a concern about a patient's condition, what is the right structure for that conversation?
Great distinction, Citra. Casual talk is, "Hi, how are you?" Interprofessional communication is structured and goal-oriented. In a critical situation, you can use a simple structure, SBAR, situation, background, assessment, recommendation. It's a tool used worldwide. Let's practice the English for it. Situation. "Dr. Jones, this is Citra in the ICU. I'm calling about the portable X-ray on Mr. Tan." Background. He is intubated and his oxygen sats just dropped to 88%. Assessment. I'm concerned about the position of the ET tube on the image. Recommendation. I've sent the image. Could you review it urgently for tube placement?
I like the idea of shared clinical reasoning from the last session. But how do I offer an opinion to a senior radiologist without sounding like I'm telling them their job? What English phrases can I use?
Demas, that is the art of being a great radiographer. It's about being assertive, not aggressive. You are providing data from your unique position, at the patient's side. Use language that shows you are offering information, not a diagnosis. Phrases like, "I'm flagging this for you. I wanted to bring this to your attention." Clinically, the patient is presenting with, for example, "Dr. Lee, I'm flagging the right lung base. The patient has a fever, and I noticed the image looks a bit hazy compared to yesterday." You aren't diagnosing pneumonia. You are connecting the clinical picture, fever, with the image, haziness. This is shared reasoning, and most radiologists appreciate the context. It helps them see the full picture.
Sir, after the scan is done and the radiologist is interpreting, what is our role? Do we just wait for the report, or is there a specific handover we need to do, especially if the patient is going back to the ward?
Excellent closing question, Eka. Your role doesn't end when the image is taken. You are the link between the patient and the radiologist, and then between the radiology department and the ward. You need to perform a clinical handover. This is a key ESP skill. Before the patient leaves, you ensure the images are sent to PACS correctly. Then, If there are any issues, like the patient was in pain and moved, or they have a specific concern, you should document that in the system or tell the radiologist directly. For the ward nurse, if the patient is unstable, you give a quick handover. I've completed the chest x-ray. The patient is comfortable now. The images are with Dr. Lee, who will review them shortly. You close the loop. You've done your part, and you've communicated clearly to the next person in the chain. These were fantastic questions. Today, we've learned that clinical English is more than just medical vocabulary. It's about 1. Using descriptive language to stay in your scope. 2. Communicating problems with diplomacy. 3. Using structured tools like SBAR for emergencies. 4. Offering observations with respectful phrases. 5. And closing the loop with a clear handover. Mastering this language is what will make you not just competent radiographers, but trusted members of the healthcare team. Thank you for your attention, and I'll see you next week. Take a moment to read through these 6 scenarios. For each one, I want you to think about, what would you say? How would you say it professionally? And why would you choose those words? Let's begin. Question 1. Scope of practice. A new patient asks you directly, "The doctor said I might have a small fracture. Can you see it on the screen?" How would you respond in English, ensuring you stay within your professional scope while being helpful to the patient? Question 2. Patient preparation. An elderly patient for a barium enema is confused and anxious. The radiologist asks, "Is the bowel prep adequate?" You suspect it may not be perfect based on the scout image. How do you communicate this to the radiologist using diplomatic, professional English? Question 3. Interprofessional communication. You are performing a portable X-ray in the ER on a trauma patient. The radiologist is not in the room. You see the monitor show a possible widened mediastinum. Using the SBAR framework, what would you say when you call the radiologist? Question 4. Shared clinical reasoning. A postoperative patient arrives for a chest X-ray. They are short of breath. During positioning, you notice the skin around their neck feels crackly, subcutaneous emphysema. How do you communicate this observation to the radiologist to support shared clinical reasoning? Question 5. Professional handover. You have just finished a portable X-ray on a ventilated ICU patient. The nurse was not at the bedside when you arrived. After you finish, the nurse returns. What is your 1 to 2 sentence handover to the nurse? Question 6. General reflection. In your own words, explain why a radiographer needs to be proficient in clinical English, even though they are not the ones writing the final diagnostic report. Compromised patient safety. It's the tool that allows our technical skills to be used effectively by the whole team.
Practice is the key to mastery. Every effort, no matter how small, gets you closer to perfection. Keep going. Your dedication will pay off. Latihan adalah kunci menuju penguasaan keterampilan berbahasa. Setiap usaha, sekecil apapun, membawa Anda lebih dekat ke kesempurnaan. Teruslah maju, dedikasi Anda akan membuahkan hasil. Salam dari Pak Budi.